After a PCOS and infertility diagnosis, my partner and I made the decision to pursue IVF. Aggressive medical treatments, medications, and many, many months of tears finally resulted in a positive pregnancy test. Our prayers had been answered, but that joy didn't last. Our 15-week checkup confirmed that my son no longer had a heartbeat. We were informed of my son's death at 10 weeks and 4 days, almost 5 weeks prior. I'd experienced what is called a silent miscarriage. Though my son passed, my HCG levels remained high with his body still intact. For how long, we didn't know. Due to the large gap between his demise and the present date, my doctor informed me that I was high risk for sepsis and for the safest outcomes, required a DNC or medical abortion. Following this procedure, I had a drastic change in my mood and my presentation. I cried all the time. I lost my appetite, and frankly, I was easily pissed off. And I even considered the comfort that death might bring. My bright and optimistic personality had seemingly disappeared. Even in spaces filled with colleagues, family, friends, I felt completely alone. Many assumed I was simply grieving the loss of my son. This assumption was also made by my doctor, who took the time to gauge my continued interest for fertility treatments, but did not assess me for perinatal mood and anxiety disorders or general safety at my follow-up appointment. I was not referred to a mental health provider nor given resources that pointed to support. If it weren't for my direct knowledge of mental health due to my occupation, I would have continued to suffer silently with postpartum depression and suicidal thoughts. I would like you to take these 3 points away from my experience. 1, policy influences practice and practice impacts policy. As a clinician, I understand the word practice to simply mean shared experiences. Therefore, it is extremely important that the shared experiences you bear witness to this morning acts as a roadmap for policy revision. 2, statistics confirm that nationally, 1 out of every 4 pregnancies will end in child loss. Sadly, women throughout Arizona will experience unexpected fetal demise, miscarriage, and stillbirth. 1 out of every 4 will experience grief. Regardless of perspective or bias, these are still postpartum mothers that have drastic changes in their hormones following the birth of children, and they're trying to adjust to life post-pregnancy. Without proper assessment or referral, we risk the health and safety of these individuals. I boldly ask that we consider ways to reinforce the importance of mental health screenings for those in the postpartum period. I also ask that all postpartum mothers in the state of Arizona are provided resources that increase their awareness of specialized mental health services and providers to make this supportive care more accessible. And finally, your support within political spaces, it ensures that all birthing persons are heard, and it provides quality services needed to heal and thrive during the postpartum period. Though I lost my son, I still gave birth to a miracle in this work. Thank you for allowing me to share my story with you this morning. Together we can and will improve maternal mental health outcomes.